today I'm going to show you some acupressure techniques you can use when you're travelling to help you stop pain. There's nothing worse than being on an aeroplane and having a lot of pain. I've had happen to me before. I've had friends that have called me and said, "Oh Maria, I'm travelling tomorrow and I've got this sciatica, I've got this neck pain, what can I do?" You're stuck on a flight and you're in that pain, and you can take some painkillers if you've got them, but sometimes you just don't want to take those painkillers, or you don't have them on you. What can you do to help that pain? So this video series is going to help you learn about how you can use acupressure to help stop pain. So acupressure is based on the principles of acupuncture. Basically, it's just pressing the points instead of needling the points. So you're using your own fingers or other areas of your body, or something like maybe a pencil. Let's say the back of a pencil, I'm using that as a little tool to be able to press in on those points. So let's think about sciatic pain for one, as the first one, because this is a common thing, and it's also it's going to be a really good idea to show you how it works. So I'm just going to grab my little model man here. And they don't usually have all these needles sticking out of them, that's just me being silly with him. But what we're going to do is we're going to look at sciatic pain and what we can use, how we can use acupressure to treat it. So pretty much with sciatic pain, it's pain that people will get on the buttock, down the side of the leg. So in Chinese medicine, so it's the gallbladder channel usually. Now sometimes it can be the bladder channel, and this is really important with this style of acupressure to work out where is the pain first. What channel is the pain on? So you need to know if it's on your buttock, on your back side, more on the side, or is it more down on the back of the leg. So if it's more on the side, it's going to be the gallbladder channel. If it's more on the back of the leg, then we'll call that the bladder channel. So the points that we use, the way we use to balance this out, this is based on like Dr. Tan's balance method of acupuncture. Pretty much what we're going to do is just going to pick 3 channels that balance that gallbladder channel, and you're going to use acupressure to press on those points. Now, this works quite well with acupuncture, and if you use it with acupressure, if you try it with acupressure that doesn't work, doesn't mean acupuncture won't work. The thing with acupuncture and acupressure that's made the big thing that's different, one is there's needles used versus no needles used. The other one is that with acupuncture you can needle 2 or 3 points at once, and that does actually make a difference, rather than like only having one hand, having to press this hand, then press this point, then press that area. So that is one thing to consider. But when you're on the plane, or when you're travelling, or you're stuck in an airport or something like that, and you're in a lot of pain, you can still try this to relieve the pain. And yes, it does work to relieve. It can relieve some of the pain and get you moving. So let's say that the pain is on this gallbladder channel. So this is your buttock side or going down the side of your leg. And it doesn't matter if you have it here. Sometimes people have pain here, and sometimes people just have pain around the side, or even sometimes down the foot. It could be tingling, numbness. Again, with any pain, just make sure that you have it diagnosed by a doctor. If you're not sure what the cause of that pain is, then don't use this video as a replacement for going to your doctor. Use your common sense and do that. So, but we're just going to assume that the pain that you have, you know what the cause is. You know that you have sciatic pain. So gallbladder channel. So we pretty much want to use the balancing method uses a mirroring system. So what that means is that from your waist here down to your foot, we're just going to lay him down. This is your waist here. So the mirroring system means that this is your waist, and your knees. The points from your knees down to your foot this is your waist, and then this goes down to your head. So for instance, if someone had pain around their head, we'd be thinking of a point around their foot. Or on the arm. So if someone had pain on this part of the body, then the acupressure point that we're looking for is going to be either, if it's right on the lower back, it'll be around the elbow. But for sciatic pain, it's usually sort of this part of the forearm, kind of down here, or just down there a little bit. That's one part of the mirroring system. The other part says that this can be your waist as well. So sometimes people can have, these feel like trigger points. A really sore point, as you press along the channel, you'll feel like one really sore point. So your waist can be your wrist. What that means is you might have a point, which is common for the gallbladder channel, on the Sanjaya channel, or the triple warmer channel, around this area of your elbow. So the forearm, basically. If the pain is right on your hip, then you're probably going to be looking for a point that's around crease of the elbow or the crease of the knee. So this little man here, the Sanjaya channel, the triple warmer channel, is this one that kind of goes back here, and he's kind of coming like a little zigzag around the forearm there, and then to the between the ring and the pinky finger here. So his channel is basically, if you make a crease of your elbow, it's a bit further than that. Now, when you're doing acupressure, it's not going to kill you if you do the wrong point. Okay, so don't be worried, oh Marie, I didn't have the right point, I wasn't sure if I was on the Sanjaya channel or not. What I suggest you do when you're first learning to use this, if you've got the time, if you're sitting there on the plane and you're in a lot of pain, it's easy to use your elbow, okay, and your forearm, because they're right near you. It's harder to press the points on your legs, because sometimes unless you know that exact point, you can reach down and grab it. It might be harder to do that. It depends on how much room you've got on the plane and all that sort of stuff. So on your elbow, you can basically just feel around that area until you feel one spot. So you could, if you didn't know the channels, you could just push around there and say, oh, I remember Marie said your waist, like the pain's around here on my side, so there'll probably be a point around here. And you just compress using your fingers until you find, oh wow, that feels really sore. Like that one point feels like really sore. Now I can't really feel any sort of sore points on me right now, but you'll probably feel like something, oh, you know, that feels sore. So you just kind of press that point, and then I'll show you some techniques you can use once you find the sore point to do that. So how you want to find the sore point is, if you know the channel, you can just press down the channel using like 2 fingers or 1 finger, and try to use the same pressure as you press down, 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 and then you think, oh, there's a little sore point there. Where's the most sore point? And you might roll across it and feel like, oh yeah, that really feels sore. And so that's your trigger point. Use that point, so you know what that point is. Now, if you're finding a few points on your body, you could just like use a little pen. If you're in the plane, you could probably you might have a little texter or a pen, and you could just go, oh, where did I feel that little sore point? Oh, I just felt a sore point there. So you know, I can come back. You can come back to that and press that. No worries. If it's sore and you're pressing it, and you come back to it, it's going to be more sore when you come back to it anyway. So it's not like you're going to lose track of where those points are. So the first one is the Sanjaya. So usually for that Sanjaya channel, if we look at this little man here, side of this is your large intestine channel here, and then this is your Sanjaya channel kind of coming at the side here. So most of the time, there's commonly, like if your Sanjaya channel comes down to here, there's commonly a point here, okay, around here. And if you have pain on the back of your leg as well, then we'd usually be using a point on the side here anyway. And so this little area here is a common one. There's lots of different styles of Chinese medicine, of acupuncture, and even with this acupressure. So with this balancing method, the main point of it is to find the one spot that feels sore for you and press that, rather than like, oh, here's 3 points that you should use that work for everyone, because the thing is, it doesn't work for everyone. It works for like 90 or 80% of people, but other people might be slightly just a bit different to that. Depends on where exactly their pain is. Like, I've seen sciatic patients, like heaps of them, and no patients have the pain in the same place. Some people just have numbness in their toes. Some people just have pain, like a shooting pain going down their leg. Some people have a lot of lower back pain and stiffness in their back, and they have leg pain, and they have tingling and numbness. You know, it can be really variable, like where the pain is. Some people have a lot of pain on the ITB area around the side, right on that gallbladder channel at the side of the legs. It can be lots of reasons and lots of different permutations of sciatic pain. So it makes sense that the acupressure points that are going to balance that or treat that will be different for each person. So that's the Sanjaya one. So sometimes it can be this point here between the 2 fingers, or sometimes it could be at the crease. So again, if the pain's right on the lower back, then could be here. Or if you go between the 2 bones, so if you feel either side of the hand, of the wrist, of the forearm, you'll feel 2 bones there. So just between that radius and ulnar bones, you'll feel like a little soft depression-y part. That's the Sanjaya channel, like sort of between there. So if you feel like, oh, there's like a little spot that's sore, so you could, it doesn't matter if you pick 2 or 3 spots, just use those spots. Now this is important. If usually what will happen is for the Sanjaya channel, this is to balance the gallbladder channel, it'll be the opposite sides of the pain. So if you have pain on the left side, then you want to use the right side Sanjaya. I'll write this down in the notes on the video for you. So it doesn't have to be. So if you palpate that channel and you think, oh, there's no pressure points around, I can't find any on that side. Well, go on this side and go, okay, I'm gonna like feel that Sanjaya channel and go down and oh yeah, I can. So as it comes here, it kind of goes towards the middle here, goes in the middle on this forearm part here. So you want between the two bones, and then kind of coming off to the side like that onto the elbow. So firstly Sanjaya. The next one is the heart. So that's also the heart channel is on your hands as well, nice and convenient. So this will be the other opposite side. So let's say I had sciatic pain on my left, left side sciatic pain. So the Sanjaya would be the right side. So I'm pressing that point. With acupuncture, we would like needle that point, and then we would come to the other side. So on the heart channel, on this side, your heart channel goes basically under like your axilla, your armpit, at the side. So crease of the elbow. This is really easy. So from here down the side, and then to the palm. So like opposite the your Sanjaya channel. So it's kind of the opposite. So if you sort of needle there, you come through to the other side on that point. So most of the time for pain, I find that people have a really tender spot in here. With like that'd be the place I'd look first if you're just like desperate to stop the pain. And what you need to do with this is why it's maybe tricky to use acupressure just out of a book where they don't show you all this detail like what I'm showing you. Here's another thing you can use. So I love these like little rounded edged things. Between the two bones, you have to press in really hard. Like I'm pressing that pretty hard, and I'm also pushing my hand against this paintbrush, and you can see it's like pressing in like that. That's the only way you're going to be able to get enough pressure there to actually get the result. So when I'm pressing there, I can feel in my finger here, my ring finger, and a little bit in my pinky, I can feel tingling. So that means that I'm getting the chi in the point, like it's working. So basically you just push along there. You could use like this kind of technique. A lot of acupressure things use that. Now I've pressed that really hard, it's unnecessary, it's pretty too hard. But if you're in a lot of pain, sometimes that would work, and you would just press and press and press, and then you'll be like, oh, my back is like feeling better. So if you're sitting in the chair in the plane, you would press those points and give your back a little bit of a wiggle around. So once you find that one spot that's sore, then move your back and think, oh, where's the pain that I feel, and press that, and try to loosen up your back a little bit. If you get up in the plane, like you might be like walking, pacing up and down, it's better if you press these points while you're walking around. So press into the points that are hurting, sore for you. So that's the first two. The next one's on the liver channel. So this is for the gallbladder. So we've had Sanjaya, we've had heart, and now we've got the liver channel. So your liver channel is a little bit less easy to get to, especially if you're sitting in an aeroplane seat. There's a few little tricks you can use. Sometimes it's a point on your foot here, so between the toes. And your liver channel kind of comes up the side of your leg to the crease of your knee. So we're not really caring about this part of the liver channel here. It's more like this being your waist, the knee, and then so this being sort of, if the pain's here for the person, then it'll be, excuse me, here that you want to find that point. So what we'll do is, I'll show you on my foot. I mean, obviously you can't really do this in the aeroplane, it's a little bit hard, but you want to use your liver 3 point is 1 point. So you can sometimes use something that you can press into it. Sometimes when I've been on the plane, I'll use my other toe, take my shoes off and use my other toe to press in between those two toes, the first and second toe. So that point is kind of exactly mirroring this idea of this point here. So if these are two toes, they're in between those toes and you're pressing in that spot there. The other spot you can try is like here at the crease of your leg. So you've got two tendons just here, and there's a point called liver 8 that's kind of there in between those two tendons, and that'll usually be pretty sensitive. And it doesn't really matter, like if you come just right behind your tibia, just behind there, that's your spleen channel, and that's just off that, so it's this way. But to be honest, if you find one spot that's sore and it's helping you back, just press on that. So around here, but quite commonly it is that liver 8 that's quite sore. So if you're sitting in a plane, you just kind of pressing it, holding it, and then wiggle your back around. So those are the 3 points that you want to use. Sanjaya channel, heart channel, and then the liver channel. That's for the gallbladder. Now, with sciatic pain, it could be the bladder channel. So like I said with this little man, sometimes it's both as well. If you have pain like right in behind the buttocks, so this is your ischial tuberosity sort of area, so if you sit down and you feel like the bones of your bum, that's the ischial tuberosity, that bone that's underneath there, and there's sort of pain as you sit down on that, or the pain's like feels like it's behind your leg, in your calf, then that's bladder channel. So your bladder channel goes behind there, the gallbladder channel covers like the side of the body. So if it's the bladder channel, do exactly the same thing, but there's just 3 different channels that you use to balance that. So the first one is your small intestine, and that's the one that I was saying before. Your hand, it's really common. So press that way too hard, that heart channel. Here at the side. So the small intestine channel kind of comes here, or at the side, and oh yeah, exactly, side like that. So where I was saying the heart channel's kind of here, and then at the side here, the small intestine channel kind of comes here, and then it goes more on the what we call the yang aspect of your body. So it's kind of along this bone and this part. Now, just yang aspect is like at the outside, this part, and the yin aspect is like the sensitive part on the inside of your body. So it's mostly this point here. Now, if you make a fist, and we'll use a pen to show you where it is, like the height of that crease, that's where small intestine 3 is. And that is a great point to start with. Now, again, like I showed you with some other videos about acupressure, it's not just tapping the point and pressing on it like, oh yeah, you've pressed the point. You haven't done anything doing that. You have to push right in. So this point is actually the needle would slide under the metacarpals a little bit when we needle it. So you can either use something like this dirty paintbrush I happen to have. Here's my Apple pencil. You could put the cap on it. Yeah, so you can probably have one of these when you're traveling, and you can use the Apple pencil to press on that part of it, and you can use that as a little presser. That's better than your finger because you can actually get more leverage like this. I mean, you could even use this pointy part of the pencil, but you just don't have to, and it really points in. I've used that before when I've been on a plane. It really presses in, but you don't have to press too hard with this, so be careful you don't sort of press too hard. Anyway, this point here is under the metacarpal, so that 5th metacarpal, it's right underneath that. So it needs to be there. Or you could be between, in this little crevice here, you've got the crease of the wrist, just in that little crevice, there's a point there. You can press that. If you can't find any acupressure points there that are sore, so you're basically just palpating, oh, do I feel sore there? So don't just touch it, push it in a bit and feel if, like, when you push in and move around a bit, is it sore? You can come down, so not the heart channel now, but just coming down on this part of your body around there. So just kind of pushing in and seeing if there's any little spots that, oh, that one may be a little bit, that might be a little bit, and see which one is the most sore point. So your goal is to find the most sore point. So that's the first one, small intestine. Then the next one's the lung. So again, this follows the alternating sequence. So I would use the small intestine side on this hand I had the pain here. So if I had pain on my bladder channel, on, let's say this is me, and the pain's on this side, on the right, with my bladder channel, I'm going to use the left side small intestine channel. And then the lung channel will be on the other side, so the lung channel will be on this side. Now, lung channel's kind of, sometimes it's in this area. This is called your thenar eminence, this little spot here. And what you want to do is palpate around here and find, is there a sore spot there? That's usually a common spot, but it could be anywhere sort of down here. So your lung channel's kind of in the middle. Well, it is in the middle, but it's off to the side there of that tendon. And you just want to feel through that part there like that. Just sort of pressing until sometimes it's a point here. So again, if you had a sore point here, then you'd probably be thinking the pain's like around the calf or around here. So yeah, you're just doing that. Now, sometimes with sciatic pain, like I said before, sometimes people can have pain in two spots. They don't just have pain in the side, they have pain in the lower back and in the side. So don't be surprised if you have one point that's like, hey, that's really sore, but like this is also sore. So you can press both of those points. There's nothing wrong with that. So we've done the small intestine, then we've done the lung channel, and then we're going to do the kidney channel. Now this one, again, the leg, sort of like the liver, can be a little bit difficult to find these ones. So kidney channel goes right through to the inside of the foot, right to the inside of the ankle. And we're looking at the side of the leg. So the common spots that you might find are going to be here. So this is your ankle bone. You can't really see because I've got stockings on. There's a bone there. And so halfway between the calcaneal tendon and your medial malleolus. So just there in that soft part. And there's a few kidney points around this area. So it doesn't matter if you go closer to the bone and you feel like, oh, there's a sore point right there. So use that point. Now, if you're in a lot of pain on the flight, you probably can't bend your legs, or if you're like a bigger size like me, you probably can't bend your legs like a yogi. But you probably could bend down with a pen and press on those spots. So sometimes I'll just run the pen down my legs, and oh yeah, that's really sore, and just like press on that spot, and just press as hard as you can stand it, and then leave it. Okay, so I've showed you a couple of points you can use for acupressure for sciatic pain on the plane, and this is based on using the Dr. Tan's balanced method of acupuncture. If you are in pain, and you can get to an acupuncturist, that would be the quickest way to get rid of the pain using this method. It'll be quicker than using acupressure, like acupressure versus acupuncture. But yeah, you can try this when you're traveling, and some of these points it could be used for different kinds of pain, as long as it's along that channel. If you have pain on those channels, that's how we would treat it. So just to recap some of those points, the commonest ones would be this area here. So this whole area of your hand. It could be, if it's a bit of bladder and a bit of gallbladder, then you might have something on this Sanjaya point here, heart point here, small intestine point here. So this little area here of your hand is a good spot to massage. And sometimes I'll find one or two points can relieve the pain. Sometimes you need to do all three of the points. So if you find that this is enough, just do that, and then you might have some relief for a few hours. And then if the pain comes back, you can start using the other side, or start doing that sequence all over again. So I'll pop the points in and the links to those in the link below. And I hope you have a great trip, and yeah, hope you don't have pain when you're traveling, but I know that does happen. So hopefully this will be useful to you. If it has been useful to you, I'd love you to subscribe to my channel, leave a comment below, and we can help other people to get to know how they can use acupressure when you're traveling. Thank you.